So now in this short video I will tell you the main concept in histamine, right? In antihistamine there is a very main concept based on that histamine response, physiological response in some part of body, right? Well, see, let me tell you the effect of histamine first. So when histamine is released, it shows some allergic inflammatory response, and these responses are dilation of blood vessels. So it causes blood vessel and lowering the BP. That's right. It increase the permeability of the blood vessels that will cause edema, right? Fluid accumulation. Okay. Then smooth muscle of lungs leads to bronchi constriction. Notice here what it said, that smooth muscle of lungs in bronchi, they get constricted. What they get constricted. And in blood vessel, the muscles also are smooth muscles. In blood vessels muscles are smooth and they are getting dilated, and in lungs it getting constricted and muscles are smooth. So this is the main caution, and in GPAT and NIPER the most probability to come from here, and I saw some MCQs from here. So stimulate gastric secretion, this is the one of effect of the histamine. Now the question is why it causes dilation in blood vessel and why it causes constriction in smooth muscle in lungs, right? At both places we can say that the receptor is same, whereas the histamine effect if give its effect, the receptor is same. If we consider think like the receptor would be different, so the receptor is same, and same is the chemical moiety which is acting on this receptor, and in just two different locations it giving two different effect with the same muscles, right? The smooth muscles in blood vessels, it get dilated, and in lungs it get constricted. You must be thinking how it is happening, you must be wondering it, right? So let me tell you this, how it is happening. In blood vessels there is endothelial cells, right? And there is smooth muscle. So the receptor, H1 receptor, is not directly present on smooth muscle. It is present on where? It is present on endothelial cells, right? So it is present on endocells, right? Endothelial cells of blood vessels, all right? And not present on where? Smooth muscle. But it giving its effect. How? When histamine bind to endothelial cells, it shows like it is GQ protein receptor. H1 receptor is GQ, and it follow that IP3 DAG and DAG. So all these are formed, right? Then it cause, so there is a PLAC also, phospholipase C. This is what a mechanism. I'm just telling you in short. It primarily it cause increase in calcium, intracellular calcium is increased inside the cell, right? So this increased calcium in endothelial cells will leads to release of what? eNOS. Now you must be wondering what it is, and if you are a good student you know what it is. eNOS is endothelial nitric oxide, and nitric oxide is one of the mediator which will cause vasodilation or muscle dilation. If I tell you, if in case of penis erection, so that is the nitric oxide is the mediator which will cause the relaxation of the muscle and dilation of the muscle, that why penis get erected. So this is the mechanism there, and the mechanism of there is also same, that nitric oxide will go to muscles, smooth muscle, and cause what? Its dilation. This is how it affects. Now in case of lungs, the smooth muscles are constricting. Why? Now here the H1 receptor is directly present on smooth muscle only, right? It is present on smooth muscles. H1 receptor is present on smooth muscle, and the histamine is acting directly here, and it cause like GQ, which is followed by PLC, phospholipase C, and then IP3 DAG, IP3 and DAG. Then it cause increase in calcium Okay, intracellular calcium is increased, which leads to what? It cause myosin kinase activation, which will release which will cause that muscle constriction. What? Muscle constriction. Which muscle? Smooth muscle. Hope you got it. This is the difference, the main difference, and the concept behind this logic. You must be right confused if you are studying, if you have this some brilliant question in your mind. You may be confused why it is happening. So I explained you in a particular good manner. Hope you got it, and subscribe to the channel if you like it for GPAN and iPad. Thank you.